And welcome back. We're coming to you once again from Neurometabolic Associates, located in the heart of Linden. Come on by. Number of issues. If you have a thyroid issue, diabetes, Parkinson's, and you're not getting the results, the desired effect that you want, Dr. Anthony Sears may be your answer. Dr. Sears, I want to talk a little bit about your book. You're the author of your 21st Century Doctor. What's that all about?
So I wrote that book about 3 years ago, and like I said, I talked about the stats of American healthcare. I knew there had to be something out there better. So I wrote that talking about the alternative medicine, what we do and what we do differently, and we got to start making some changes. So I wrote a lot of motivational stuff in that book, thyroid and diabetes.
All right, and today, or during this segment, we're going to concentrate on Parkinson's. So tell me, what is different about your approach when you're dealing with a Parkinson's patient or a pre-Parkinson's patient?
So I do what's called functional neurology. It's a little bit different than as far as normal neurology. And what we do is we look at what's going on in the brain. We also have some really neat technology we use as well with Parkinson's called neurofeedback. Okay, and neurofeedback is it's a special computer designed to retrain your brain, and you have different lobes in your brain. And what we find out in most Parkinson patients is you have a frontal lobe, and you can measure that if it's over-aroused or under-aroused or if it's balanced. Most of the Parkinson's patients that come in have an under-arousal of the frontal lobe. So we have a machine, we just watch movies, and while you're watching movies for 30 minutes at a time, it helps retrain the brain to bring the frontal lobe back to its normal capacity there.
Okay, and before we talk to a couple of patients and newfound friends, before we talk to them, what kind of results, what kind of feedback do you get from patients if they come in here and they're suffering from some symptoms of Parkinson's after they have this type of treatment? What do they say?
It's really neat stuff. You know, when I talk to some of my patients here, we have a family atmosphere here anyways. And by the way, I love all my patients. These two are two of my favorites here. And when you talk to them is, you know, some of these patients come in, they don't even tell me they have Parkinson's. They're coming for other things. And I say, you know what, let me try to work on this. I have some new technology I'm doing. Let's see what happens. And that's what happened with these two patients here. We kind of took Miss Hadley, her husband was a diabetic patient of mine, and then she says she has some Parkinson's. We worked on that. And same thing with Mr. Thomas here. And the results have been astounding. I talked to Mr. Thomas at the front desk, and he goes, Doc, how long is this going to last? I don't know what he's talking about. I said, what do you mean it's going to last? Your pain or what's going on? He goes, I don't shake anymore. I haven't read a paper in how long? How many years was it?
It's been quite a few.
A long time. And he said, now I can read the paper and read the sports page. So I was like, it really kind of took me back that we got results that quick with it. And all we're doing is retraining the brain, using some technology we have to make it, to bring it back up where it needs to be at.
All right, let's talk to a couple of folks, a couple of patients, friends, who have actually experienced some positive effects from the treatments available here with Dr. Anthony Sears. All right, first of all, Dolores Hadley. Can I call you Dolores?
Sure.
All right, Dolores, tell me about some of the symptoms you were feeling before you came to see Dr. Sears.
Before I came, I had the trembling inside, which was much worse than the outside. My lips would tremble, and my hands would just go like this. I could not read a paper. I'd sit on the floor and put the paper. I couldn't read a book. And now then, I can hold a book. I can read the paper. I pretty much do anything I want to. I'm at least 90% better.
90% better. That's quite a bit.
I do not have the inside shaking. And a year ago, if it hadn't been for my family, I wouldn't have cared if I lived or died.
Oh, Dolores, I hate to hear that because you're a beautiful lady and a nice lady to boot, which is a nice combination.
You.
Okay, so tell me, how long did it take for you to feel these positive effects?
Well, I think I felt him in about a month or two, didn't I, Dr. Sears?
Ma'am, that's rather quick. Did you expect, or had you tried other methods and had not received positive results?
I tried medicine, and I sat with my head. I was sicker than a dog. Could not use them, and I talked to my family physician, which is Melissa Hall, and she fully agreed that I should do this.
All right.
She was all for it.
Well, I'm glad you're getting positive results. It's good to see you smiling.
Thank you.
All right, I'm going to talk a little bit to Stephen Thomas. Okay, Stephen, tell us a little. You mentioned the fact, because all of us guys like this, we love reading a sports page. You say that was hard for you before, right?
Sir, I couldn't read the paper without laying on the floor and having it flat. And now I can hold the paper up and read it. I guess my friends noticed at first. They said, you aren't trembling as much, you know. And I come to Dr. Sears first of all for my back, and I read his sign out there about Parkinson's disease. And I've been on Parkinson's disease medication from the VA, and it did not work. But I've improved 95% in just a couple of months.
Wow, this technology is amazing. For those out there, Stephen, who may be a little apprehensive, they're hesitant, they have Parkinson's, and they're saying, maybe this won't work for me. What would you tell them? What would you tell them?
Try it.
Yep. Yeah.
Talk to Dr. Sears. He'll tell you what information he has on it, and he will get you help.
All right, Dr. Sears, I'm curious. How did you learn? Obviously, this is new technology, and to me, it's life-changing. You see, we're talking to two patients here who said it changed their life for the better. How did you discover this? I mean, who originated this technology?
It gives me goosebumps, and listen to the stories here. And that's why I do what I do. And it mostly originated from functional medicine, okay, or not functional medicine, but more functional neurology. There's a Dr. Fred Carrick. He's out of Atlanta, and he actually is the one that worked on it. He's a pretty famous guy. He did functional neurology. He said, you know what? I didn't invent new neurology. I took the concepts of neurology and put new applications to it. And he's the doctor of Sidney Crosby, who had a lot of issues in the hockey arenas, and a lot of famous players that way. And what happens, I'm just applying what I've learned through this. I've got 300 hours of postgraduate hours in functional neurology. So I just applied what I knew and took the technology we had with that. And I got some colleagues doing this stuff in different states as well, kind of saying, we're getting amazing results of Parkinson's. You need to try this, this, and this. So, and we started trying it, and it's amazing, the results we're getting.
It's interesting, Dr. Sears. So what it amounts to is, you know how the brain works, and you're just applying that knowledge. There's been a lot of research and studies about the brain, so you're saying, okay, this is how it works. If we rewire the brain for Parkinson's patients, we'll get the desired effect, and it's working.
Absolutely, just like working out. So you tell you work out, you stay in shape, you can work out, and your muscles get trained. Same thing with your brain. If you find out where the deficiency is at, you can train that part of the brain to bring it back up where it needs to be at to function properly.
I don't see any shaking, any trembling. I have a friend of mine who has Parkinson's, and it's really, really an issue. So I'm so glad that you guys, it's life changing. Your life's changed for the better. Am I wrong, Stephen?
Sure. I would highly recommend Dr. Sears, and I'm way happier than I used to be, sir.
I love hearing that. Dolores, you feel the same way?
Yes, I do. They say that they can't cure Parkinson's, and I said, I don't know if you can cure it or not, but you can sure help it.
Wow. Yeah, that's the rewarding part of your work. As you said, you're getting goosebumps, and it's probably feels great every single time. You're probably a little bit jaded. You see a lot of patients getting results, but that's got to feel good, Dr.
Absolutely. Absolutely.
We love you. All right. If you'd like a free consultation, perhaps you're is there a pre-Parkinson stage when people know, hey, maybe I should do something like this and get in front of it? Does that help if they get in front of it?
Because a lot of times spouses will be the first one to recognize. You start to get a little shake, a little tremble. That's when you got to start getting on it. If you see a little quiver in your face, if you see kind of twitches in your face, you know something's coming up. It just doesn't happen overnight. It kind of keeps on creeping up little by little.
All right, that number on the screen, give it a call. Again, a $250 consultation, absolutely free. Coming up here, we're going to field some calls from you. If you have any questions for Dr. Anthony Sears, it's a mixture, again, of natural medicine with modern medicine. If you have some questions, 571-5263. He is the author of Your 21st Century Doctor. He is Dr. Anthony Sears. We'll be right back on Wave 3 Listens, and yes, indeed, we are live.